myself, Dr. Kishore Kumar, the hematologist and bone marrow transplant physician from Miyot International Hospital, Chennai, India. We all know 19th of June this year has been designated as the World Sickle Cell Anemia Day. So I thought I'll share my insights about this crippling sickle cell anemia disease with you people today. In all human beings, the blood is actually composed of three blood cells. One is a red blood cell which carries oxygen, the other is white blood cells which give immunity to us, and the third one is the platelets which prevent us from getting a bleed. We all know the red blood cells are beautiful circular disc-like structures which are very flexible, which enables them to go through the small blood vessels in the body to every nook and corner of our body. The sickle cell anemia is actually an inherited genetic disorder where the child is born with two abnormal hemoglobin genes. One is from the father, one is from the mother. Many times they themselves never knew that they are carrying an abnormal gene with them because the other normal gene would have made them look quite normal, and many times these parents do not have an idea that they are actually carriers of sickle cell anemia. When the child is born with sickle cell anemia, both the hemoglobin genes are abnormal, and this makes the red blood cells lose their flexibility and take a sickle-like shape. They are quite inflexible, so whenever they are trying to enter into a smaller blood vessel, they are unable to do it and they tend to clog these blood vessels. So if the clogging of the blood vessels happens in the lungs, the patient will present to us with a very severe chest pain. When it happens across the bones in the body, the patient may be presenting to us with severe bone pain. These are all problems which are very much manageable and not life-threatening, but sometimes we do get patients where the same phenomenon can occur in the brain causing a stroke, or it can occur in a heart creating a really life-threatening condition for the patient. So these kids, their development is affected. They may sometimes have a very low blood count needing repeated blood transfusions. Sometimes their immunity is very low, resulting in multiple infections again and again and again. So because of this disease has been really taking a toll on these children, and these children do suffer a lot. If you geographically look at the disease, it is quite common in the northern part of the African continent and in India, in some coastal areas or coastal states of India. This is, as I said, on World Sickle Cell Day, I may talk a lot about how I actually treat my patients of sickle cell anemia, but I think as a hematologist, my duty is to create an awareness among the people and make them understand that sickle cell anemia is a highly preventable disease. Provided the father and mother had a simple blood test to check for sickle cell anemia genes in them, it is very much possible to prevent the birth of a sickle cell anemia child. So I think this should be the agenda for the day. We should aim to prevent sickle cell anemia rather than thinking about treatments to cure it. But still, that's a futuristic aim. Unfortunately, today we have got a lot of patients from different parts of the world who are really suffering from the sickle cell disease. And we can understand the agony of the parents who find it very difficult to see their child suffer again and again in front of their eyes. So when they ask us, doctor, especially in this COVID situation, it is really becoming tough because many times the chest crisis or the painful crisis in the chest of a sickle cell disease mimics a COVID infection. So that creates a lot of confusion in actually treating these patients. Sometimes when this patient gets admitted long and they even end up with COVID, this really kind of messes up with the situation, and that's quite a confusion out there. But somehow in our setting, we have been very much able to do or clearly demarcate the COVID positive and COVID negative patients, and we are able to provide the right care that is needed for these patients at the right time. But when you talk about, these are all, whatever I do for a painful chest syndrome or for a stroke, whatever the treatment I do, they are all going to be temporary solutions. But if somebody is going to ask me what is a permanent cure for a sickle cell anemia, my answer to them is to do a allogenic bone marrow transplant. What I mean by an allogenic bone marrow transplant, I take the stem cells from a normal person and transfer it to the patient who is suffering from a sickle cell anemia to get back the normal red blood cells. Initial days, the problem we used to face was who will be the donor for them. The best donor for them, who will be fully matched with them, is the siblings, their own brothers or sisters. But sometimes the problem is the brothers or sisters also would have been affected by sickle cell disease, and it becomes a really tough situation to get stem cells for them. In those scenarios, we tend to search across the world. We call it as unrelated donor searching, matched unrelated donor searching. But the possibility of finding a properly matched donor for any individual in the world is 1 in a million chance. So that again makes the situation more tough at this point. But with advances in the science of bone marrow transplant, and also with our vast experience of more than 1,000 bone marrow transplants in our center, we are very well able nowadays to think about doing transplants from the father or mother who is going to be only half a matched with the kid. This we call it as haploidentical bone marrow transplants, and this has been a big time success in all different types of hematological conditions like leukemias and other kinds of malignant disorders. Now slowly to conditions like thalassemia and sickle cell anemia also, this is picking up in phase, which actually means that in the near future, there won't be any sickle cell anemia patient whom you are going to deny a transplant, saying that the patient, he or she hasn't got a bone marrow donor. So that is the beauty of doing a bone marrow transplant in a country like India, which has got a really vast experience in this particular science, and especially in a center like ours, where we have got an experience of more than 1,000 patients. So with this positive note, I want to end my talk on the Sickle Cell Anemia Day. And as I said, we all will take a pledge to create a world which is totally sickle free, mainly by preventing the birth of a sickle cell anemia patient, and also try to give the best possible care for patients who are already suffering from sickle cell anemia. Thank you very much.